Next, we have is Miss Shilpa Joshi. She's a registered dietitian in Mumbai Diet and Health Center. She's National Vice President, Indian Dietitian Association and Honorary Secretary, All India Association for Advancing Research in Obesity. She is also the director at Mumbai Diet and Health Center. She's a practicing dietitian at and a diabetes educator, vice president from 2019 to 2021 at Indian Dietitian Association. She is also honorable secretary at All India Association of Advancing Research in Obesity. She is also a master trainer in diabetes conversation maps. Over to you, ma'am.
Thank you so much, Dr. Bansal, for the kind words of introduction. And at the outset, I would like to thank Dr. Neeta Deshpande and Dr. Sanjay Agarwal to have given me this opportunity to speak on the topic on diet for complications of diabetes. So just to begin with, I would like to tell you that medical nutrition therapy is what is used for management of diabetes, whether it's type 1, type 2, or GDM. And one of the goals or a specific goal of management of use of MNT in management of diabetes is to prevent or delay progression of long-term complications of diabetes. Now, there are two kinds of complications. So when we begin with, the immediate complications like hypoglycemia, the MNT, what is recommended is if the blood glucose level is below 70 milligrams, it's very important to treat it with 15 grams of carbohydrate. And this carbohydrate has to be simple carbohydrate in nature and not sweets. That is something which has to be remembered. So it can be 3 glucose tablets or a fruit juice or a regular soft drinks, half a cup, nimbu sharbat or a hard-boiled candy or sugar or honey, which is 1 tablespoon. One has to wait for 15 minutes and again retest and repeat this process if the blood sugar does not rise enough. It's important, and the last line is actually very important. It's very important not to treat hypo with things like mithai and chocolates. Now, what are the guidelines for managing, for avoiding hypoglycemia? So it's very important to eat small meal with small snacks interspersed. Spread intake of carbohydrate evenly through the day. Avoid foods which contain a large amount of carbohydrate. Avoid excessive intake of beverages containing caffeine and limit or avoid alcoholic beverages and decrease the fat intake. Now we know that dawn phenomena is a huge problem, and to prevent that, one has to prevent nocturnal hypoglycemia. So in that, a bedtime snack is recommended, and the bedtime snack should have a lente carbohydrate or a long release carbohydrate so that it can match the action of lente insulin which is given. For brittle type 1 diabetes or even in glycogen storage disease, what is used is raw cornstarch, because raw cornstarch has high amount of amylose and therefore it keeps up the sugar throughout the night. The other complication which is very common is chronic kidney disease, and this is a complication which requires a lot of dietary modification. So it's important that EGFR is estimated, and these are various equations where you could estimate the EGFR. Now, once there is albuminuria present, it's very important, or rather beneficial, to have reduction of protein to 0.8 gram per kg body weight. Now, this is important. This is a research published globally. In India, one doesn't have to change anything because Indian diets really do not have 0.8 gram per kg body weight of protein. So, there is no modification which is required. But also very important is to limit intake of phosphorus to 500 to 1000 milligrams per day along with this protein diet. The patients who have nephropathy and who have hypertension, also it's important to limit their sodium intake to 2000 milligrams per day or about a teaspoon of salt per day. Sorry. Now this is in patients with CRF who are on maintenance, that is, who are not undergoing dialysis. So it's very important that they are given high calorie diet, a diet with about 30 to 35 kilocalories per kg body weight. It's very important, but the protein intake has to be lower than 0.6 gram per kg body weight. Any higher protein intake is going to increase creatinine further. So this is the difference between diets pre-dialysis and post-dialysis. And in pre-dialysis, you give about 0.6 gram per kg body weight of protein. Whereas if it's hemodialysis, you give up to gram to gram 0.2 gram per kg body weight of protein. And if it's peritoneal dialysis, try to go up to 1.5 grams per kg body weight of protein. And besides that, it has to be high calories, and about 30 to 40% calories should come from fat, which are basically unsaturated in nature. And of course, if the person is undergoing dialysis, then there isn't so much of titration of electrolytes required. But if the patient is not on dialysis, then it's very important that it is a low sodium diet and the potassium intake is restricted to about 60 milliequivalents per day through the diet. So again, the same thing, protein intake with moderate renal failure, about 0.6 gram per kg body weight. And if the patient is taking a keto analog or essential amino acid supplements as a part of therapy, not on dialysis, then the dietary protein is further restricted down to 0.28 gram per kg body weight. Now, what kind of protein to give, whether animal protein or vegetable protein? Now, there is study to show that vegetable proteins are better, especially proteins which come from soybean. So soybean do far better than, proteins which are non-vegetarian in nature. But what is recommended is protein intake has to be equally divided between animal protein and plant-based protein. Of course, BCAA are always given because BCAA and particularly ketoleucine have shown to reduce muscle protein degradation. Now, fat recommendation for patient with chronic renal failure. Again, 30% calories coming from fat. It's very important to restrict saturated fat to up to 10% of calories and cholesterol less than 300 milligrams per day. Salt restriction is mandatory to about 5 grams of salt or 2,400 milligrams of sodium per day in case of renal disease. So these are various naturally high sodium containing foods, and what needs to be really restricted is bakery and bakery products, and of course some fruits and vegetables which are high in sodium. Also, if the person has high electrolytes, especially potassium, if the patient is in hyperkalemia, then these kind of food which have ragi, bajra, wheat flour, all pulses, all dark green leafy vegetables need to be restricted in individuals who has hyperkalemia in renal failure. Phosphorus also needs to be restricted, and it's very important. So the easy part is protein, phosphorus, and potassium is commonly present in the same kind of food. Food which are high in protein are also high in phosphorus and potassium. So when you restrict protein, you automatically tend to restrict potassium and phosphorus. But more specifically, phosphorus is very high in seeds and nuts. And therefore, if the phosphorus is high, restrict taking nuts and oil seeds as a part of the diet. So these are again various requirements for individuals who are undergoing transplant. And again, in case of transplant, the protein intake recommended is very high after 4 to 6 weeks of transplant. Now, in case of gastroparesis, there has been no formal evaluation of any dietary modification for diabetes gastroparesis, but it is very important that the individual consumes a diet of frequent, small, low fiber, low fat meals and increases nutrient liquids to reduce gastric load. Therefore, it's very, very important that solids be separated from liquids when such a problem happens, and elemental diets which have amino acids or some other carbohydrates are very easy for a patient with gastroparesis to handle. In CVD, again, lifestyle modification involves all the nutrients which are important in CVD are dietary fat and cholesterol, soluble fiber, and a special emphasis should be laid on plant stenols and plant-based steroids. And these are coming from nuts and oil seeds, which are so very important in diet. Again, limitation of dietary fat to 25 to 35% total calories in a day does not mean that it has to be severely restricted. So don't look for fat-free diets. Just look for diets which are lower in fat, up to 25 to 35%. Recent evidences have also shown advantage of Mediterranean diet where fat intake is sometimes up to 40% in case of CVD. So these are step 1 and step 2 diet, which are recommended by NCEP, that is National Cholesterol Education Program, wherein you're talking about total fat to be about 30%. Now, there are various kinds of oils, and MUFA-rich oils is what is recommended in diet. And it is recommended that oils which are consumed should not be heated because they form malonyl dialdehydes, which are markers for lipid peroxidation, and they are carcinogenic in nature. It's recommended that a lot of nuts be consumed in CVD because nuts do not have cholesterol in them. They should be recommended, and fiber intake should be improved. The last complication, that is hypertension. So lifestyle modification for hypertension includes weight loss, following a diet plan which is dietary approaches to stop hypertension, that is a DASH diet, which includes reduction of dietary sodium and higher intake of potassium. So these are all the factors which are responsible. These are all the effects of dietary factor and patterns on BP. And we have seen that as long as weight, sodium chloride have a direct effect, and potassium, magnesium, calcium have an indirect effect. So it is important that these factors should be considered while a person with blood pressure takes a diet. So what is a DASH diet? Diet which is rich in fruits, vegetable, low fat dairy, low in total fat, saturated fat, and cholesterol has been shown to reduce blood pressure. So the recommended amount of sodium is about 2.3 grams per day, which means about 5 grams of salt per day. And it's very important to limit intake of processed and preserved food, okay, like papad, pickles, chutney, or even ready to eat snack, because that have a huge impact on blood pressure control. Last slide, and very important one, because this is a question which is frequently asked: what is the effect of alcohol? And it has been, observational studies have shown that there is a dose dependent relationship between alcohol intake and blood pressure, particularly as when alcohol intake rises about 2 drinks per day. So whether red wine, white wine, or any kind of alcohol, the effect on blood pressure is that it will increase blood pressure. So that should be recommended. So in conclusion, dietary modification as per complication of diabetes helps in better management of diabetes. Thank you so much for a patient hearing.
Thank you very much.